This episode is brought to you by Bakalaki, finest Greek food to support a healthy Mediterranean diet. Hello and welcome back to On the Couch with Nici's special Heart Health Edition. I have MacDonald here from the Harley Street Heart and Vascular Centre, here to answer your pressing questions about heart health and heart attack prevention. I just want to make it clear that this is not specific medical advice for anyone. These are just general answers to your questions. I highly encourage anybody that has any concerns to go to the Harley Street Centre and get specific advice. So you've got 3 locations. What are they?
That's right. We've got clinics in Gleneagles, Novena, and the new clinic in Orchard.
And all your cardiologists are from the UK?
Yeah, we're all from the UK.
Which is great because you understand the healthcare that many of us are used to. So your clinic can provide a full screening for everyone?
Yeah, we provide screening for all heart diseases. We have a full suite of tests in the clinic. So if you have any symptoms, we can put you under some different tests. Plus we can also screen for any risk factors for heart disease.
The difference between a heart attack and a cardiac arrest?
Okay, so a heart attack is when you get a blockage in an artery, and it usually causes pain and breathlessness and sweating, and it can sometimes cause a cardiac arrest. A cardiac arrest is usually when the heart stops suddenly and a person collapses.
How often do people who suffer cardiac arrest survive?
Okay, so it's about 20% of people will go on to survive a cardiac arrest. There's a much higher chance of survival if someone gets dealt with very quickly and they've got a very fast heart rhythm that can be shocked with one of the defibrillator devices.
We're often asked, has anybody in your family suffered from heart disease? How likely is it that this is passed on?
If you have a family history, it usually means, has your mum or dad had a heart attack? It's more important if your dad has had a heart attack before the age of 55, or your mum's had a heart attack before the age of 65. That's what we call a strong family history. Everyone needs to be screened for certain risk factors for heart disease.
Even if there's no family history?
Yep, absolutely.
Okay.
When you get to above the age of 40, if you've no family history, you need to get your cholesterol checked, your blood pressure, check for diabetes. You need to be looking at your exercise and your diet, and if you smoke, stop smoking.
Have there been cases where somebody's come in to do a screening with no history, just as a regular check, and you've detected something that has posed as a great threat?
Yeah, absolutely. When you check lipids, because if you have a high cholesterol, you often have no symptoms at all. And when you check a blood test for lipids, people can have very high cholesterol, which can lead to very accelerated coronary artery disease at a young age.
I presume that most people would get their cholesterol checked as a basic wellness test, don't they?
You can go to your GP for some screening, but we have all the equipment on site, so if you need tests done, we can have them done that day.
Oh, wow. So it's a quicker turnaround.
Yeah, definitely.
Okay, great. We all know that smoking's bad for you. How much does smoking increase the risk of heart attack?
A smoker is 2 to 4 times more likely to have a heart attack than a non-smoker.
Okay.
And they're 70% more likely to die of coronary disease than a non-smoker.
Okay, so somebody has a heart attack and they're a smoker, it's harder to revive them? Is their heart weaker?
Smoking causes inflammation and accelerates coronary artery disease. So it accelerates the development of coronary artery disease, but it also causes the plaques in the coronary arteries to get inflamed and to rupture, and that's the cause of heart attacks.
Can you look at those? Is there any test that you can say, oh, they're getting a bit...
Yeah, we use a number of different tests to have a look at your coronaries. We do a CT calcium score, which gives us a rough guide as to how much plaque disease you've got.
Okay.
We've got a CT coronary angiogram, which is a non-invasive way of looking at the plaque and looking for blockages in the heart arteries. You've got diagnostic coronary angiograms for people that have got chest pain and heart attacks. So they're the main ones at looking at the actual amount of plaque disease.
What can we do in life to ensure a good, strong heart? We know exercise, we know good diet, getting your cholesterol checked. I think these are all kind of, people know these things. Anything else?
You said them all.
Oh, that's it.
So
that might be it.
That might be it. It's pretty simple lifestyle advice. It's having a good diet. It's exercising a lot, 150 minutes. That's 5 times a week, 30 minutes. Okay. It's not smoking. It's keeping your weight in check. It's making sure your blood pressure, your glucose and cholesterol are there. These are the main things that cause heart problems.
What about alcohol?
Yeah, alcohol. So alcohol in moderation is okay. It's fine.
What does that mean, moderation? Does that mean drinking a bit every night or never having a bender? Like, people do go out and they do drink heavily once a week, let's say.
Once in a while, a little bit more alcohol, it's not going to really do you a huge amount of harm. If you do it every night, then definitely it's going to cause some problems.
Warning signs for any sort of heart issues are different in men and women. What should everybody be looking for?
Okay, so there are definitely differences between men and women. Most women, however, get the same signs as men. Usually it's chest pain, maybe sweating and breathlessness if you're having a heart attack.
Okay.
But women are usually 10 years older than men when they have a heart attack. They're protected by their estrogen pre-menopause. Now, there are certain things that women get that more likely than men, and that's if they present with breathlessness or back pain or sweating rather than the classic chest pain.
Okay, but sweating can be due to hormonal changes, menopause, we get hot flushes. How do we know the difference?
It's difficult. If you're having a heart attack, you'll often feel very unwell with it at the same time as having sweating.
Okay.
And if you have any concerns, you should always see a doctor, get an ECG and be assessed.
Okay, so any signs before the signs that you're actually having a heart attack? Is there anything to look for before that, just in life?
So in some patients, you'll get a run-up period.
Yes.
So in the week or two before, maybe they'll start to get tightness in the chest or little bits of sweating or breathlessness that are out of place. These can be the kind of key markers of something developing in the coronary arteries.
Okay, so people have got to be kind of in tune with your own body and what's normal. And if all of a sudden you're thinking you're feeling symptoms that you don't often have, don't dismiss them. Just go and get checked. Taking into account that people have various fitness levels, is there a limit to which people can push themselves or should push themselves? What's the recommended maximum heart rate?
Okay, so exercise, I want to reiterate, exercise is so important for cardiovascular health. It's one of the biggest risk factors for cardiovascular disease if you don't exercise. If you've never exercised before, you should be aiming for about 150 minutes a week with a maximum heart rate of about 70% initially.
70% of what?
70% of your target. So you work out your target, you take 220, you take away your age, and that's your maximum predicted heart rate.
Regardless of fitness level?
Regardless.
Is there a dangerous minimum or maximum heart rate? Some people may have a resting heart rate that's really low or really high. Are either of those cause for concern?
Yeah, when people are really fit, they often get a very low resting heart rate. If you have a low heart rate and you're not very fit, you should definitely get it checked out because there's some disorders that can cause slowing of the heartbeats. If you have a high resting heart rate, it can sometimes point to things like thyroid disease or underlying cardiac disease.
So above what?
Usual resting heart rates are around about 70 to 80.
Yeah.
If it's always more than 70 or 80, then you should consider getting a test. Come up to our clinic and we can have a look at you.
So why is it that triathletes or marathon runners, really fit people, can just drop dead?
It doesn't happen very often, but when you have a marathon, there's always one or maybe two people that drops dead suddenly during the race.
But they're fit.
The usual cause is an underlying either coronary artery disease in the older people, or it's an underlying cardiomyopathy in the younger people.
Okay. There's a huge kind of midlife crisis point where a lot of men decide, I'm going to run a marathon, or women as well. I'm going to run a marathon. They would be at high risk as well because they've just launched into it with no preparation. Yeah,
we recommend pre-participation screening. So if you're going to suddenly go from being sedentary to training for a marathon, come up, we can do a stress test, we can look at your risk factors and decide if you need any risk factor modification and if you're healthy enough to run in the marathon.
So if you're having a midlife crisis or your partner's having a midlife crisis and decided you want to run a marathon, which I know is on a bucket list for a lot of people, please get a proper health screening before you do. If somebody has arterial buildup, can they reduce it with treatment?
Okay, so there are ways to reduce the buildup. Most of the time, what we do is we prevent it getting worse. But it's been shown that if you take cholesterol-lowering drugs, then sometimes you can get regression of plaque disease in the coronary arteries.
So you can slow down the build-up from there, but can you fix what's already been damaged?
Yeah, there have been studies that have shown some reversal of plaque build-up, but most of the time it is stopping progression or slowing progression. We get people in for risk factor screening. We do something called a calcium score, which if it's 0 means you're very low risk of coronary disease. And you have people that smoke 40 a day and have done for 30 years, and they have essentially normal coronary arteries. And then you get people that don't smoke that have horrendous coronary arteries, which is why you need to come to our clinic and get assessed properly.
Okay. If somebody's controlling their cholesterol and blood pressure, potentially with the help of medication, are they still susceptible to heart failure?
Yeah, definitely. So if even somebody who has incredibly well-controlled blood pressure, cholesterol, doesn't smoke, they can still have heart attacks. We never say someone's no risk. They're always low risk.
But if you know that you're a risk and you've been to the doctor and they said, take this medication and control this.
We can never completely
minimize. So how often should they get checked?
So everyone should get checked over the age of 40.
Yes.
If you've got family history, get checked much earlier.
And then how often?
How
regularly?
If you're completely normal in your first screen, then once every 2 or 3 years.
Okay.
But if you have got abnormalities, then you probably need to get seen more frequently.
We could probably have a whole episode alone on this next question, but there are so many different dietary regimes that we're told by the media to undertake for a better heart. There's keto, low carb, gluten-free, plant-based. What and how should we be eating?
Great question. Most of the diet studies are short and uncontrolled. The two main diets that actually have a lot of evidence for preventing cardiac disease and strokes are the Mediterranean diet and the DASH diet.
What's the DASH diet?
So it's an acronym for dietary approaches to stop hypertension. They're really similar diets.
I don't think the Mediterranean diet gets as much attention as some of the others. Are there any regimes that you would say don't do?
Well, the keto diet, no one's really sure.
Okay.
When you start taking high fat and high saturated fat, which is often the case with the keto diet, you can push your cholesterol up. I personally tried a bulletproof type coffee drink, which had coconut oil in the morning. And I checked my cholesterol before and after, and I pushed my cholesterol up by 30%.
So no bullets?
1 month.
Wow.
Yeah.
What's that attributed to? The coconut oil?
It's the coconut oil.
So we shouldn't be eating coconut oil?
It's really high in saturated fat. And if you're susceptible, saturated fat pushes up your cholesterol. It's one of the highest contents of saturated fat.
So which oil should we be cooking with, eating?
Olive oil, definitely. Okay. It's at the heart of the Mediterranean diet. Extra virgin olive oil it's been shown in all the studies to be associated with less risk of heart disease.
I think a lot of people are going to be Googling the Mediterranean diet right now. I know I will be. There are people who know that they're walking high risk, they're drinkers, they're smokers, they're overweight. What screening should they be doing?
So we do the general screening for blood pressure, lipids, etc. But we can also add in a CT calcium score, which is a non-invasive test of the heart. Doesn't require any injections, but allows us to get a rough approximation of how much coronary artery disease that person's got then.
Okay.
If a patient gets symptoms like breathlessness or chest pain, they can then go on to get a CT coronary angiogram, which is the one where you get an injection, and you can actually directly visualize the heart arteries. Okay.
And how much overweight is too overweight? Because I know people don't use a BMI anymore. What's the barometer now?
We still will use a BMI. I think it's when your weight starts causing you problems. It's a continuous scale weight. It's not just defined categories. Yeah. The fact is that being increased in weight increases your blood pressure.
Yep.
It increases your cholesterol, and it has an effect on your joints. So if it's starting to cause problems for you, then you need to think about losing weight for the kind of long-term effect.
People know when they're overweight that it puts stress on their heart. Everybody wants to lose weight, but what if you just can't? You're just not having any luck with any sort of dietary regime or wellness program, and you are worried about your heart. How can somebody lose weight?
Okay, yeah, well, weight loss is really difficult, and there are ways that we can help people. If your BMI is over 30, there are medications that we can offer now that will help you lose weight, and they're very, very effective. It's not like the old medications where they all had heart problems. These medications are actually heart neutral, don't cause any problems with the heart, but they help you lose weight over 6 months to a year.
You've got a medicine that somebody can take that's safe, that can help lose weight?
Yeah, exactly.
Okay then, with no long-term negative effects?
Minimal long-term side effects.
You may have a rush on your clinic with this, but what do people ask for if they're coming in to speak about weight loss?
The drug itself is called Saxenda, which is one we recommend.
Or they can just come and say, I want that drug that helps me
but we don't give it to everybody. You have to be assessed first.
I know, but if you fall into that category where you're worried that you can't beat the bulge, it's nice to know that there's something out there.
Yeah, exactly, to help you.
Sleep apnea. Many people suffer from sleep apnea. How does that affect your heart in the short and long term?
So sleep apnea is really common. About 30% of people in Singapore have it. It causes big problems in the heart. If you imagine that the people with sleep apnea, they stop breathing multiple times during the night.
Yeah.
Their oxygen levels plummet. And during that time, the body undergoes a stress response. You produce lots of adrenaline. And over the long term, it can cause heart failure, atrial fibrillation, puts up your blood pressure, and increases your risk of coronary disease.
Menopause. How does menopause affect the heart?
So women are protected by estrogen pre-menopause. When you lose your estrogen, your cholesterol tends to go up. So you find that when women have a heart attack, they have a heart attack about 10 years after men because they're protected by the pre-menopause. After menopause, they tend to have the same issues that men have when it comes to the heart.
So with regards to testing and screening, somebody can be walking around with no symptoms and have a problem going on that they just may not know about.
Yeah, exactly. One of the commonest things is to have a high cholesterol that you don't know about.
Yep.
Blood pressure, having high blood pressure causes no symptoms. Despite what you might hear, people don't get headaches when they have high blood pressure. You feel completely normal.
Wow, which is why you say every single person needs to get tested.
Exactly.
The takeout from this is that every single person needs to get tested. You could be walking around with a problem and you don't know. Go to the Harley Street Centre, get tested, find out what's going on. Don't leave this to chance. Thanks, everyone.